Welcome to my presentation where I'm going to describe our psychoeducative intervention for informal caregivers and the preliminary findings regarding changes in relationship quality. I'm Stephanie. I'm a nurse and PhD candidate at the University of Lausanne. First, I will tell you more about our intervention. The main focus of the Learning to Feel Better and Help Better intervention is to support informal caregivers to better cope with the daily stress of dementia caregiving. It is a group intervention and the groups are led by specifically trained health professionals. Regarding the content, the caregivers first learn to recognize and analyze which situations are stressful for them in daily life and why. They then learn to analyze which aspects can be changed and which cannot be changed. They then choose and use an appropriate strategy to reduce the stress. We teach them 3 strategies: problem solving, reframing of unhelpful thoughts, and support seeking. We also provide them information and training about how dementia affects the communication and the behavior, as well as how they can improve their communication to prevent tensions in daily life. The intervention was first tested with a randomized controlled trial in Canada. It was then tested in a new context in French-speaking Switzerland with a pilot study. Both studies showed significant improvement in some of the outcomes of interest. In the pilot study, we observed that the recruitment was challenging, mainly because of the length of the intervention. We therefore shortened the intervention from originally 15 to 7 sessions and tested it again with a feasibility study. In this study, we also included a new important outcome: the relationship quality between the person with dementia and the caregivers, as this aspect is important for the well-being of both these persons involved. To explore relationship quality, we performed semi-structured interviews with the informal caregivers at 3 time points: before, during, and after the intervention. To explore how the caregivers perceive the relationship quality and if and how it changed during or after the intervention. We also asked questions about intervention components which facilitated or prevented these changes. The preliminary findings are based on the 5 participants from our first group. In the analysis, we saw that 2 components of the intervention were particularly important. The first component is about providing knowledge about the disease and train the caregivers to better understand the consequences of the disease on the behavior and the capacities of the person with dementia. The second component is about training the caregivers using the systematic approach and the strategies. Combining these components, they can adapt their behavior, expectation, communications, and activities to the changing capacities and needs of the person with dementia in order to reduce stress in daily life. The caregivers reported positive reactions in themselves and the person with dementia after adapting to these changing needs and capacities. Caregivers described the person with dementia as calmer and observed less signs of stress and anxiety in daily life. They also reported that the person with dementia complimented them and showed more gratitude for the support by the caregiver. Spouses also reported that the person with dementia hugged them more. The caregivers described as being calmer too, having more positive feelings for the person with dementia and feeling closer to them. They also said they were able to show more affection. The caregivers described more calmness in the relationship. They reported to have less arguments and tensions in daily life. They also reported that they are able to enjoy the time with the person with dementia more, as they experienced more calmness, and also because they were able to adapt the shared activities to capacities and needs of the person with dementia, which also allowed the person with dementia to contribute more in activities. The analysis with 8 additional informal caregivers is currently ongoing, and the findings will be published next year. Thank you very much for your attention. If you have any questions or comments about the project, please feel welcome to contact me by email.